Well, thank you for being here tonight for the employer engagement panel called What Are Employers Looking For Anyway? For health professionals, those interested in going to some kind of health professional industry. I'm very pleased that you all are here. I mean, this is a great panel. I am just thrilled that each and one of you are here that can provide some insight to our students. So the way I like to start this off is that I will have you introduce yourselves. And if you could tell us a little bit about you, maybe what year, or you don't say what year, but you don't want to, but what your major was. Maybe tell us about your career trajectory, and then we'll go on with a list of questions. And you can just piggyback off each other. You can just jump right in. So it's very laid back, but I appreciate you being here. So the first person on my screen to the left is you, Cora. So would you mind introducing yourself and telling us a little bit about you and your career trajectory?
Yeah, absolutely. So my name is Cora Burgoyne. I graduated from the University of Kansas undergrads at the Lawrence campus in 2017 with a major in psychology. And I graduated from the KU Med campus in Kansas City 2019 with my master's in public health. So I am in the field of healthcare at the moment. I work for a large health system out here in Colorado. We have 17 hospitals across Colorado and 2 in Western Kansas. And I do a lot of administration work for them, as well as emergency response related to COVID work. I've been doing that for the past 10 months. So it's been really interesting. It's not what I expected my public health degree to kind of work towards, but after moving out here to Colorado, it was a great opportunity for me to expand my knowledge of public health and get into the field of healthcare to kind of see the other side of population health.
Excellent. Thank you. Alex.
Well, hello everyone. Happy almost Friday. Thank you for inviting me. I'm super excited to be here. My name is Alex Lopez, and I have a degree from Rutgers University, and I graduated a while back. And so my experience in terms of my career, most of my years after college, I have worked in higher education, and in the last 5-6 years I had the opportunity to focus in healthcare careers, so I've been working with KU Medical Center for a few months, or more like a couple months. And prior to that, I worked for a Metropolitan Community College, where I was the advisor of 9 different academic programs, and they all involve healthcare programs. I love working in higher education. I think the great thing, particularly working in institutions that focus on training healthcare professionals, is that there's so many components, there's so many layers, and it's one of those things that when I talk to a faculty, when I talk to a student, there's always different ways to do things better, to improve things for next semester. So it never gets old, because there's always different ways to improve the way that we train our future healthcare professionals. So I'm very lucky that I get to do what I do every day, and thank you for inviting me.
Excellent. Jenny.
Sure. Hi, my name is Jenny Mckee. I use she, her pronouns, and I see here first supposed to be educational background. I graduated from the University of Kansas with an exercise science degree, and then came right back to school and got my master's in community health education. I spent about 6 months working at the county health department level and found something I absolutely disliked doing, and stopped doing that immediately. And then I actually have been at the same job for the past 13 years. I just had my 13-year anniversary about a month and a half ago, but I've been at the Health Education Resource Office of Watkins Health Services, initially as a health educator, and now I am the program manager for that Health Education Resource Office. So spent most of my time doing community health education for a very specific population, which is the students at the University of Kansas. But now my work has shifted a little bit to assessing needs of our students, of our population, and then working with our community health educators to make sure that we're using the most innovative means possible to create positive behavior change, and hopefully increase not only the physical health of our students, but also more holistic health, including their academic wellness. So super happy to have had the opportunity to do that for a really long time.
Congratulations on your anniversary. Good. Brandy.
Yeah, hi, Brandy Burrows. I am a corporate recruiter with Medics. We are a healthcare specific workforce solutions provider. I actually graduated from KU with my undergrad in business administration in 2005. Loved it so much that I stuck around for another year to obtain my master's in education. Ironically, Medics was actually my first job out of KU. I started in our Kansas City market as a healthcare field recruiter, and have since moved out west to our Scottsdale, Arizona location. So yeah, really excited to be able to do anything with the University of Kansas being out here in Arizona now. But and yeah, I've moved over into our corporate internal recruiting side of our business, and I do mostly college relations recruiting. So I do work with a lot of universities across the country, recruiting for 18 market locations for our field healthcare and healthcare recruiting and sales opportunities that we have.
Excellent. And I'd like to, Howard, would you like to introduce yourself? I don't think you've met Brandy. I think you know the others, or possibly.
Let me say hi first. Alex, thank you for being here. Great to see you. Alex and I are working on some new things together. Jenny, who we were in grad school together, or at least not in the same program at the same time. Wonderful to see you. Cora and I consider us co-workers from orientation, when Cora was a peer advisor in the undergraduate advising center, and I was, who knows what I did in first year
I don't know
experience.
what you were doing either.
I was just dancing on stage. I was entertainment in that first part of the morning at orientation. So that's who I am, Brandy. Great to see you. I oversee the Jayhawk Career Network. And just thanks all panelists for being here. We're going to throw some questions at you and use this recording in a few different places, including on a new group that Alex and I are involved with, that's for Jayhawks in healthcare. That's on our mentoring platform. We're populating with resources right now. And as we know, we have lots of students from the get-go that when they enter school who see themselves in some facet or aspect of healthcare. So I'm going to let Kim take the lead, and I'll jump in where I can here and maybe ask some follow-up questions and things like that. So again, thanks y'all for your time tonight, and it's beautiful to see you all.
Right.
Nice to meet
Okay,
you.
the first question I'd like to ask, because a lot of students are starting to begin their job search, and they're very nervous about it, and they're trying to figure out how to navigate it and so forth. What advice would you have for students beginning their search? And maybe you could, if you are aware, what are the opportunities? What's the outlook look for in the healthcare industry?
So this is Cora. I can go ahead and start from that, since I'm closer to graduation and entering the marketplace. I applied to everything that I had one or two lines that I fulfilled in the job description, because at least it got my foot in the door and got me practicing writing cover letters and interviewing. And when I got moved on from the application process and potentially interview, being able to be marketable and saying you have some experiences versus none, or you have parallel experiences that don't exactly meet the requirements, but could be paralleled, is really important in the interview process. But again, When I was applying to jobs out of grad school, I applied to everything that I could see myself in, companies that I enjoyed. When I looked at their mission and values, because you can get your foot in the door, not necessarily in a job that you truly want, but if it's in a company that you like, there's more opportunity to grow within it. And my dog Stella is making an appearance with us.
Hey, that makes you more human.
You promised me at least the dog.
I did, yeah. She'll probably just, yeah.
Brandy, you do a lot of, thank you for that answer, Cora. Brandy, you do a lot of staffing. And so I'm sure you have kind of you've got your finger on the hot button to know what the market looks like.
Yeah, I mean, it's definitely, as crazy as the last year has been. Yeah, it's actually the silver lining is that it's actually had a really positive impact on our business. I think there's no time more than during a global pandemic in which healthcare professionals are in dire need, right? And so yeah, we have a lot of opportunities that we are currently recruiting for. My biggest thing as a corporate recruiter is just, know what you're coming into. Do some research on what you've applied to and you have an interview scheduled for. Because I mean, that's really the first thing. If I hear someone's, ultimately wanting to do something that's completely different from what we do or what they're interviewing for, that's kind of my, easy exit out of that call. So come really prepared. So our interview style is really more conversational. So we don't do behavioral style interviews. So it's not a tell me about a time when it's really about your ability to effectively communicate, really be open, be able to build that relationship and that rapport from that conversation. And through the conversation, I'm able to extract enough to know, whether you have the basic skills to do the role that, we have here, which is, it is really all about your ability to effectively communicate and build relationships with healthcare professionals that we're ultimately, matching up with our healthcare client needs. So people who, want to work with people, talk to them all day and have those kind of soft skills that you can't necessarily train or, it's not hard skills on your resume. So.
Yeah, I imagine that the soft skills you're talking about.
Mm-hmm.
Anybody else like to add anything?
Yeah, I think Cora said something that is incredibly important in looking at the mission statement of the company that you're looking into. And I think sometimes we might say it casually, but I think hopefully you all agree with me that I cannot emphasize how important that is. And one of the things that I would tell someone that is looking for a job is that look for that mission statement, and then on the website, look for evidence that supports that mission statement. And if you don't find it, ask that question during your interview. I've also tell students that they either when they have asked me, what advice do you give me for interviews? I always say, remember that yes, you're being interviewed, but you are also interviewing them. And what that's going to show is that you truly have an interest, and it's really about finding the best fit. And because I think sometimes, particularly when you're right out of college, because that was me, I was not very good. It took me a few years to get the hang of really answering questions, not just waiting for someone to ask the question and me giving them the answer, but definitely be prepared and particularly on that mission statement, and don't be afraid to ask. I couldn't find that on your website. Would you please elaborate on your mission statement, and how do you accomplish those things that you say on your mission statement?
Excellent.
May I add something?
Please.
Okay, so I love hearing what other people are saying. I've not looked for a job in a really long time, so this is always interesting for me too. When I work with students who are preparing to enter into the job market, one thing that I always recommend that they do is ask really specific questions about the opportunity that job will give you to have the kind of work-life balance that you're interested in. And if your potential future employer is bristling about ideas that you have, or questions that you have about flexing time, or about working lunches or working remotely, or things that you're interested in to create a really like well-rounded life, then that might be a key that might not be a great fit for you. Our jobs are just one part of our lives. And as people in healthcare, it's our jobs to, really carry that mantle of having, wellness, not just, in what we're eating and how much we're sleeping, but also, workplace wellness as well. So, if that's something that matters to you, make sure that you're asking your potential, future employer about that. Sometimes people in healthcare, get like D's and F's and, leading healthy lifestyles. And so make sure that that's something that you absolutely ask about. And then also, I mentioned this in my introduction for a reason. Every job that we get doesn't have to be our forever job or a job that we love. So if you try something on, it's like a pair of pants. Like you can take that one off and find another one, right? And don't quit your job until you found a new one, probably. But it's okay to try something and it not work out. That's a part of resiliency and just a part of life. There's all different kinds of things that don't work out. So it is scary to do the interviewing process, but it's just a little bit of practice each and every time.
Absolutely. And we have several tools through our Career Center. We have our mock interviews tool that you can get on and perform it in the comfort of your home and nobody else is around, just to practice yourself. Or we do have an upcoming in the interview time, the mock interviews with our alumni. So that is great information. And the thing that I was hearing a lot about are mentioning that I want to ask you about are the transferable skills. There are some people, and you all kind of thought you would go one way and then you made a detour the other way and were happy about it. There's going to be a lot of health professionals, maybe pre-med students, or thinking that they're going to go into medical school and then decide, whoa, I don't think I want to do this. Or, hey, I didn't have a high enough MCAT this time. I got to do something else. Talk to us about what some of those transferable skills, or what do you say to those kinds of students who still want to be in the healthcare industry, but don't necessarily want to go to medical school?
So in my experience, problem solving is a really great transferable skill, and being able to show examples of how you problem solve. You can use examples from working with your classmates in labs, working on projects together. Open communication is another. I know one of our Jenny, I believe, no, Brandy, you said that communication in your folks that you're recruiting. And being able to give examples on how you openly communicate, or how you communicate with folks that have different ideas than you in a calm manner. Because when you enter the workplace and you enter the job market, you're not in, college is a great place, but you can find a lot of like-minded people in college. But when you enter the workplace, they're going to meet with people on a daily basis who have different jobs than you, have different goals. And so being able to communicate with them about a specific project or the goal of a project in an effective way is really important. I think project management is a really effective skill as well, because you can be a good project manager in any field and in any topic, as long as you can keep your folks on task and have a good outcome at the end. So yeah, open communication, project management, and yeah, are the transferable skills that have served me well in interviews and jobs that can easily be talked about in any interview.
Kim, can I just ask a clarifying question?
Sure, you bet.
Okay, hey, so you wanted to know what to tell people who maybe are like, med school might not be for me, but I still love healthcare.
Mm-hmm.
Okay, so and the transferable skills. So when I got to KU, my mom and dad dropped me off and they were like, you're going to be a nurse. And I had to remind them that I faint every time I see a needle enter someone's body. So that did not happen. But what to me is that they heard me talk about how I love helping people. I love health and wellness. It's a huge passion area for me. So I would tell those people that think like, okay, why did you think you wanted to be a doctor? What about that thing? You know, what about that job? And I think that they would find that there's a lot of other careers in healthcare that boil down to that idea. And there's so many of those, so many. I teach in the HSES department at KU, the Health, Sport, and Exercise Science department, and we have a lot of pre-med students who are in the exercise science tract, who after a while in that track, like, hey, maybe not med school, maybe one of these other things would work really well for me. And some of those things that really catch them, maybe like non-medical, but other ways they can make a difference in the health and wellness of their communities, actually are social justice based. You know, healthcare has a beautiful opportunity to heal people, prevent illness, but it was also set up in a way, like everything else in this country, for certain people to really, really, really get ahead and succeed, and other people to be screwed over, right? So, you know, figuring out ways that we can utilize our platform of, you know, healthcare to actually, you know, dismantle some of the systemic social justice issues, I think is something that we need a lot more work in, and a lot of people, you know, that are interested in healthcare now could help get that done. And some of the transferable skills that Cora mentioned, thinking about problem solving, thinking about, you know, being an effective communicator, will all help to make that happen. But I usually find that healthcare issues are social justice issues, kind of one in the same. So that would just be my advice, is find out, you know, why you fell in love with it. And there's probably another career path out there for you that's healthcare related.
That's outstanding. I think that's really true. Howard, were you going to say something? I'm sorry.
Well, I want to introduce Caroline, because Caroline's a student, and she popped in, and then we've been direct messaging, and it's amazing the way that the conversation has gone, because it's like you're talking about Caroline and we don't even know Caroline. So Caroline, do you want to introduce yourself and just tell folks kind of where you are in school and what you're looking at?
Yeah, sure. Hello, I'm Caroline. Yeah, I'm actually exercise science major. So when I heard you, I knew, I was like, oh my God, what?
Caroline, that's what I got my undergraduate degree in.
Oh, really?
Yeah.
What classes do you teach? I don't think I've taken a class with you.
I don't think you have either. So I teach human sexuality. It happens in the spring. It's the best class you'll ever take. Besides what Howard teaches. For sure too. But I teach a human sexuality class, HSES 489, and then I actually teach an intro into community health, which is 467, I want to say. So those two, and then I teach some gender-based violence classes as well in studies. So love to see you. I can send you a class code if you're looking for a spring class.
Okay, yeah, I'll look into them.
And Caroline, you were telling me that you're looking at med school. Is that right?
Yeah. My original plan throughout college entirely was to go to med school, but then recently I'm just like rethinking about it, and like might want to try out other jobs in the healthcare field before like actually applying.
So that leads to a question, and maybe I'll go to Alex first. So, you know, we're KU. Alex works at the School of Health Professions, and so there's an obvious link there. And sometimes, and I've taught at KU for, even though I'm not in healthcare, though I am married to a nurse, I've taught many students who have gone on that track. And one of the things is I think sometimes, and I don't know, Caroline, if this is your situation or not, people don't kind of understand the scope of what those professional schools are that we have, whether they be at KU or another institution, what are some, outside of nursing and med school, what are some of those other spaces in the health professions? And then I'd like to kick it over to Brandy and Cora and Jenny and just ask, for somebody that's in Caroline's situation where she's like, maybe I'm gonna rethink med school, or maybe I'm gonna not go directly to med school, and I'm looking for other opportunities. Where are those opportunities? Either in like, hey, look here, or Cora, maybe from your situation, be like, I work at Centura Health. I know that there's a number of opportunities, at least in this area, and growing because of the pandemic, or growing because that's happens to be where the most need is, or whatever. So let's start with Alex. Like, can you just talk about what's the breadth? What does the whole thing look like?
Sure.
The School of Health Professions.
Absolutely. So in the School of Health Professions, we offer about 8 different programs. And so those are typically the programs that uh, people don't think about, or they're not in the mainstream as much compared to nursing or medical school. So I'll talk about the two, mention the first two that are the most popular, which is physical therapy and occupational therapy. So we get tons of questions about those. But the ones that are not as popular, and they are great programs, great opportunities, and another way to get into healthcare is respiratory care. It's one. Clinical lab sciences, particularly those two programs right now, they have really come up to the surface, especially now dealing with COVID-19, because of our current situation. The other programs that we have is health information management. So that is a great career for someone that wants to work in healthcare, but they don't want to touch people. Those are the individuals that are going to be managing the medical records. If you don't like fluids, none of that, if you don't want to deal with people, health information management, it's going to be great. If you are detail oriented, you're super organized, but you still want to be able to interact with health professions, and you have the responsibility of making sure that medical record gets filed properly, and it's the right interpretation, and you use those codes accordingly, then great. The other ones is dietetics, speech and hearing. It's another one. Nurse anesthesia. So those are for registered nurses that want to go into that particular focus. And I'm missing one, and I can't remember. Oh, I forgot what's. But those are the ones outside of medical school. And one of the things that we find very often is that students that look into those programs is because for whatever reason they were not able to get into medical school, or they just happen to do a shadowing and they run into a professional, and they just happen to run into that individual by accident and say, oh, I didn't know that actually that was a role in healthcare. And I think that I think Jenny said something that is incredibly powerful, is that try new things. And you never know what's going to happen. Even if you get a job and you think that you're not going to like, I would tell you, in my career, I have learned a lot more from the jobs that I have not liked than the ones that I have liked. And it's all about trying new things, because you never know what you're gonna run into, and you're gonna get that aha moment that will say, this is what I want to do. But the key to get to there is that you got to try different things, especially now that you're young, because that's what I did. I tried different things, and sometimes they would work and sometimes they won't. They didn't. But but trying new things, and I think that's a key to one of the aspects to figure out what area in healthcare do you want to go into.
And
That's
Brandy,
great.
you do a lot of different hiring for entry. What kinds
I
of
was
entry
gonna
level
say,
positions?
yeah,
Yeah.
you should get in touch with medics, because we do all different types of placements working with our clients. So, even so much as something where you can kind of give things a try through contract or contract to hire opportunities that we have, and we specialize in different areas of healthcare. So, kind of, what? Sorry, is it Alex? Alex was saying. So we have our revenue cycle division, which is kind of more of the back end or business side of healthcare. Our allied division is more of that direct patient care. And then we have a couple like specialty niche areas of focus and care management and clinical research in our scientific divisions as well. So, really, kind of everything under the healthcare gamut when it comes to the clients that we work with and the different types of opportunities that we have. So yeah, happy to connect with you offline or get my contact information to you for sure.
In Kim and Brandy, I want to make sure I have the right stuff here, and Alex too. I just put in the chat the link to the School of Health Professions.
Appreciate
and also
that.
the to Medics, where Brandy works. That's in the chat. Cora, I want to kick it to you. So you work Centura Health, and I was a little bit late, so I missed if you described kind of the scope of what your company, what your organization does. You serve Western Kansas and Colorado, is that correct?
Yep, that's correct.
And so just like as you look around Centura Health, as you work with colleagues, whether they're in your division or you're working with another department or what have you, what do you see in terms of like, where do you see those needs arising and where are hires happening and things like that for someone in Caroline's situation who's, qualified to go to med school, but it's like, I'm gonna pause and go into some other public health areas?
Yeah. So we need nurses. We need a lot of nurses.
Yeah, I feel like the phone rings I hear every night from a different hospital, and they're like, Amanda, that's my wife's name. Can you come in tonight? Like, no.
Yeah. So we need a lot of nurses. But if you're still looking into patient care, or a higher education beyond your undergraduate degree, my recommendation is to look at programs curricula and look at the classes that those are required for the program. And if you get really excited about all of them and you want to take all of the classes for that program, you're probably the right direction. But as you're reviewing the curriculum and you only find like one or two, like maybe that's not for you. And that's how I narrowed down my graduate program, because I was looking at a few different programs, and I wanted to take all the public health classes. I wanted all of them. And so that's a really great way for you to start exploring beyond medical school, if you're still looking at patient care. And if it's beyond patient care for healthcare, there's still a variety of areas you can go into. I think Alex mentioned that a lot of healthcare management and administration. It takes a lot of people to make hospitals run smoothly. So there's a lot of opportunity within hospitals to learn about healthcare administration. And in my experience at Centura Health, going back to our first question is about being marketable and being able to show that you are nimble, you can help out when needed, you're an effective communicator, you can project manage, you might get pulled into projects that are beyond your traditional job scope. And that's how you get your feet wet into other areas of in healthcare or whatever job you go into, showing that you can, you're an effective employee and you're competent.
Did you have that experience, Cora? Because I did notice, I know your title because it's on the mentoring platform, but then I also noticed, sorry, a child opened the door. I noticed that you got pulled into some COVID stuff as well. Is that right? Can you talk to us just about that experience?
Yeah, absolutely. So my day-to-day job is standardizing patient care policy practices for like regulatory purposes. So hospitals have people who come to make sure that they're performing up to standards set by the state or the Fed. And we have multiple hospitals, and so that can vary across the hospital. So my day job is to make sure that we are providing patient care in a standard way, which can increase population health, but it also keeps us out of trouble. But in March, when COVID was happening, because we have so many hospitals, we had to launch a response, like a systemized standard response to COVID, and how we were going to take care of patients, how we were going to transfer patients, how we were going to administer medication, all of it. And I was asked to help project manage a few of those responses because of my ability to project manage other aspects of my job, my day job. I was very easily able to transfer those skills over to this area of healthcare, which I had absolutely no idea about. I'm not trained clinically at all. So it was this steep learning curve, but because I had the right people around me who were able to, see what I was capable of, they saw me, they were able to pull me into that role pretty quickly, so I could help with the system with that response.
Thanks for sharing that.
Yeah.
Jenny, just to kind of close out maybe this section of questions, if somebody maybe in Caroline's situation, or somebody else, an exercise science major, what have you, wanted to break into the university healthcare system, that you work in at KU, and there are parallel positions at other universities or what have you, what does that look like in terms of as you cast your gaze around Watkins Health Services, and say, oh, here's where we're hiring, or this is where that need's going to arise. These are the opportunities that are available for someone with a Bachelor of Science or what have you, as they try to get some work experience before they go on to medical school or something like that.
Yeah, sure. As far as my specific, office goes, the Health Education Resource Office, a really great step for, community health education, and there are parallel positions like that all over the United States, is to kind of specialize into what you're interested in. So like for community health educators, you're kind of a generalist in a lot of ways, but then we usually have something that we're really, really interested in. And for me, my area of expertise and interest is in sexual health. So before I started, doing sexual health education, I actually got certified to be a doula. Helped, people through the process of welcoming new life into their homes or birth center, which was super awesome. Something I want to do again someday. And I, talked and worked with, some other sexual health educators and sex therapists. So finding a specialization, whether that's in nutrition, you don't have to be a full-blown dietitian, but there's programs, there's even a program through the KU Edwards campus right now, a nutritionist certification that would be super duper helpful. So thinking about those kinds of things, or even more generally, getting certified to be a health coach. So it's a great first step, like beyond, getting your bachelor's of science and before you start another degree program, is to think about different certifications that would maximize your bachelor's degree experience. You can also go to school, you can also have another kind of like stepping stone job while you're getting that certification that will help add to your resume. So thinking about, someone with the exercise science degree, that would be, hugely, acceptable as a prerequisite to having a job as a health educator in my office and across the country as well. Something I do know, health insurance companies and companies that partner with health insurance companies are looking for right now, though, are telephonic health coaches. So I know everyone is kind of, maybe enjoying to a certain degree, remote working. Telephonic health coaches call clients and talk them through reaching their health goals, whether they be nutrition based or tobacco cessation based. I mean, it's a fantastic way to have one-on-one patient care with someone, but do it in a way that you are talking about behavior change and preventing other health issues from coming up in their life potentially. It's not all altruistic. The people that you're working for are doing it to save money, health insurance companies, but you are doing something that would help, the greater good, absolutely, decreasing health determinants for population. So those are just some things from my area that I definitely see on the rise, and certifications cannot be underscored enough as something that I would absolutely recommend if you're in between kind of making a decision about what you want to do.
I saw a lot of head nodding when you said telephonic coaching. Does anyone want to, Cora, including yours, do you want to comment or follow up?
Yeah, I think this pandemic has just expedited care moving to the computer, to the phone. We set up a lot of telehealth capabilities that are at all hospital over the past 10 months, and it's not going away anytime soon. So it's just a new market of jobs that are coming up, which might appeal to some people. Being able to work from home all the time, that's definitely a new area of our market that didn't exist before, which has just been expedited again by the pandemic. So I was just nodding my head, just like, yes, the future is Zoom.
Brandy, I thought I noticed you too. Is that something that MedX is works with, or do you see that as well?
I mean, we still as an organization are working 100% remote, but very rarely did we ever see any of our clients allowing that remote flexibility. And we have so much of that now, which I think is pretty cool, from a recruiter's perspective, that it's just opened up the talent pool so much. So, so yeah, it's definitely the wave of the future if we can do it.
Is there any talk of that, Alex, at the School of Health Professions?
So actually, I had a conversation with one of our OT instructors, and one of the things that we were talking about was, when this whole thing came about, they were talking about components of the classroom, or certain things that there was no way that they were going to be able to teach those virtually. And after giving it a try, they were like, actually, we just have to think outside of the box. And so I think that what I think, especially in higher ed, I think there's going to be a lot of components that will probably stay virtually, just because we never try it, certain delivery of lecture. So I see that certain components are definitely, I think, are going to stay for a while.
Okay. So I'm going to pivot a second, and we're closing in near the end of the hour. So let me frame the question this way. If you work on a campus, Jenny and Kim and I work on KU's campus. Alex works in Kansas City, but on campus, there's a certain set of skills I think that you have to have, or mindsets that you have to have in order to maybe thrive and flourish. An example would be, if you don't like change, you shouldn't work in higher ed. You should anticipate that there'll be changes. Different administrative, again, Cora and I work together. Different administrators come in. There's shifting priorities based on all sorts of inputs and metrics, or what have you. Higher education can be really siloed, and so understanding that and having some skills to break down those silos, communication skills, simply showing up to support programs that other departments are putting on, that type of thing. My wife works in a hospital. It seems to me that working in a hospital is a very specific type of work culture. Jenny, your office is in a hospital. Cora, you sounds like, before pandemic, you're working with many or in many different hospitals. Alex, you're working with instructors and students who work in hospitals. Brandy, you're recruiting people who work in hospitals. If we're talking to students about those skills and that they might hone and build, mindsets they might develop, and also information they might need to be able to adjust to a hospital and maybe thrive, regardless if they're in occupational therapy, if it's a nurse, if it's, they're in administration, they're working, what have you. Uh, is there anything that you would say? I hope that question makes sense. I was trying to frame it in a very specific way. Is there anything that you would suggest to students about, like, these are some things you need to prepare to understand or do to be successful in the hospital culture?
Yeah, if let me jump on that if that's okay. So
Yeah, please, Alex.
one of the things that I've learned being working with both instructors, coordinators, students in healthcare programs, um, and I'll give you an example. So my niece is going to be a senior in high school next year, and so I told her when in the fall semester, I said the most important skill that you need to have, particularly if you're going to be working with a patient, is that it is very important that you listen and answer every question that your patient is going to ask. But what's even more important, and this is what's going to make you the professional, is that you listen and answer every question that your patient is not asking.
Hmm.
And I think that's critical thinking right there. And I think it takes to some individuals, I think it takes a little bit longer to develop that. But I think that's really the core of being a healthcare professional, and it's applicable to everywhere. It's to every industry. Both if you're working with students one-on-one, if you're working with the patient, if you're supervising, or if you're working with another coworker, that's where that sense of I am the professional, I am the expert. That's when it's the yeah. So I don't know if that makes sense.
It totally made sense to me. And I'll also, in higher ed, we talk about critical thinking all the time. That is goal one, learning outcome one of the KU course. See, I still got it, Cora. And we use it, but it's sometimes I feel like we lose sense of what that is. But I always understood the word critical from a healthcare perspective, because Amanda worked in the critical care unit at Stormont Vale. So that meant the patients that were there were either they were very injured or very sick, and the care that they were given and the way that their bodies responded to that care was going to make the difference in whether they went this way or went this way. It was a critical juncture, right? And so I really like that you tied critical thinking to healthcare, because I think that those things, the healthcare is the way that I personally understand the idea of what critical thinking is. So I really like that a lot. And I like that you highlighted listening as well, Alex. Let's go to some of the other panelists. Those skills, those mindsets you need to make it in a hospital.
So I can jump in. So working in a hospital is very different from working in a corporate work environment, because everything is happening all the time. And we were going back to change, like you were saying, Howard, higher education, there's always change. There's always change in a hospital setting as well. Okay. You're literally confronted with life and death, sickness and health all the time. Doesn't matter if you're a healthcare professional providing care. If you work in the administration, you're going to hear all of the calls overhead. You're going to see the admits and the discharges. It's just all happening. And so it can be really inspiring. It can also be very draining. Inspiring meaning you see the patients and you see the population that you're serving every day. Draining meaning that you also see the patients that are dying every day or not getting better. And so it kind of depends on where you want to go with that. It is very, again, it just kind of depends on how you want to work and the environment and the people that you want to surround yourself with. It's good to have that balance to keep you grounded in the work. But yeah.
That's wonderful.
It's
I
really good.
really, I had
Um,
never thought about that, Cora, about never like, that's the thing, like higher ed's always changing. I'd never thought about that in the hospital context, and that makes total sense to me now. Thank you for that. Jenny or Brandy?
and Howard, I want to make sure that we have time because we have a question from Caroline, a couple
Okay,
questions.
great.
Sure, I can go. So as far as working in a hospital and not being like a doctor, like a provider, as it's called, something that I had to learn fast and hard was I was going to hear the word no a lot, or we can't do that a lot, or that's not the way this works a lot. So there was a lot of like taking a big bite out of a shit sandwich for a while for me. And what I had to learn to help me help the people that I am serving is that I had to learn how to collude with the healthcare system, because it's made to help people, but it doesn't make sense the way that it works all the time. So figuring out how to build bridges with people, how to find loopholes in things, how to make things work, which I think is kind of what, you know, everyone has been saying this entire time about the critical thinking and the problem solving. But there are plenty of days where it's like, oh my God, I could like really help somebody right now if all of this bureaucratic red tape would like get out of the way and I could just serve people. So it's just really a lot about like staying super positive, because there's going to be a lot of, nope, we can't do that. This person's uninsured. We don't work with that. We don't do this. Their, you know, sex assigned at birth doesn't match up with their gender identity. So their prescription's not going through. Like there's so much of that where it's like, just give the person what they need. You know what I mean? And that is, that feels a lot like injustice to me. I just have a really hard time with it. And so I have to go back to like, how could, there is someone here that can help us work this out. There is something we can buy, like it's going to work. It's going to be okay. You just have to figure out who you need on your team to get into the nitty gritty and make it happen. So colluding with the system that you're working in is, I think, super helpful in the hospital world.
I agree 100%.
You know, I was going to ask this question, Caroline, so I'm glad that you mentioned it. You had asked, and because Brenda, you had said earlier, when people come to you, know what you want to do, know what it is that you want to do. And the question that Caroline asked was, how do I go about finding out what I'm interested in, since there's so many opportunities? And I know we talked about volunteering, but right now this is so late stage of the game. You know, you could say, oh, you take a bunch of classes and so forth, but these are graduating seniors who don't have the luxury of changing their schedule or taking exploratory coursework or so forth. What are some things that they can do now, possibly suggestions? Is that what you're kind of asking, Caroline? How do I figure that out?
I can chime in. You guys might have actually done something like this when selecting your major, but we actually have it on kind of the next phase of life. It's we call it the Medics MyPrint. We actually, as an organization, we acquired a HR technology company that's based in Paris, France. And with that, we developed our very own talent personality assessment, where we actually assess candidates' soft skills. So what we call their ABCDs: aptitudes, behaviors, competencies, and desires. And we're actually able to match those up with the potential career options that we have with our client, which is a really cool matching tool that we have both on the client and talent side, because we can actually, the service that we provide with our clients is to give them the insight into who might be a better culture fit, because we can actually do benchmarking where we're able to evaluate their top performers, their A players. What are some of those strong characteristics and soft skills that they possess? And, you know, we actually might be able to present them with talent that, again, don't match up perfect on paper. They don't have the exact hard trained skills on their resume, but we can say, hey, you might want to look at this person. You might want to consider them because, their strong soft skills and characteristics, those traits really match up well to the A players that you have on your team. And it's been really cool to see the results of that, where, they've really been open-minded about considering different backgrounds. I mean, so many organizations today have really robust onboarding and training programs. Like, it's not like back in the day where, if you didn't have the skills, like, you weren't getting the job. This is something where a lot more employers are open to talent that is a little bit more green or doesn't have, like the perfect background necessarily for what it is that they're doing. But, they're going to come in and they're going to have the work ethic and they're going to have the values of their organization. And they're going to have some of those, personality traits that's going to mesh really well with their team. So we do have a tool, the Medics MyPrint tool, where you can actually just take that. It's really fun. You're able to just kind of learn more really about yourself and what potential career opportunities that you would be really great at, given some of those strengths and soft skills that you possess that you might not have ever even thought about.
Anybody else? We just have a few, actually just a couple minutes late. I wondered if anybody had some last thoughts. I'm sure we could go on for hours, but anybody have any last thoughts that they'd like to share? Okay, we've said a lot. We've covered a lot. This has been.
I learned a lot.
Yeah, I learned a lot too. I loved hearing from every one of you. What outstanding panelists we have. Thank you so much for your time. Thank you for spending your evening with us. Really appreciate it. And Caroline, I hope you'll join us for some of the rest of the week. In the next 3 weeks, I think you'll continue to gain more and more information about job searching, resumes, and interviews. So thank you again. Thanks,
Thanks,
Howard.
everyone.
Yeah, thank you. And be on the look. Alex and I are working on, along with Melinda Fowles in the University Career Center and Samantha Dawson, on a Jayhawks and Healthcare group that's on the mentoring platform, which will be a good place to network with other folks, not only student to alumni, but alumni to alumni.